Mr. Jones. My name's Jenny, and I'm going to be your nurse today. How are you?
Fine.
Good. So I've washed my hands for your safety and protection, and my tech got your vital signs. Your blood pressure was 141/78. Your pulse was 70. Your heart rate was 70. Your temperature was 97.0. Your pulse oxygenation, you were 100% with room air, and your respiration rate was 18. So all of those are within normal limits, with the exception of your blood pressure is running a little bit high. 120/80 or anything below that would be considered normal. Have you had problems in the past with high blood pressure?
Yes, I have.
Okay. Have you seen a doctor about that?
Yes.
Yes. Okay. Good. Your weight was 155 and your height was 5'10", so that gives you a healthy BMI of 23. Okay. Any questions so far?
No, not right now.
Okay. Well, I'm going to start. I'm going to ask you some questions to see if you're alert oriented. Can you tell me your full name?
Bob Jones,
And can you tell me where you are?
Gwinnett Medical Center.
Okay. Can you tell me why you're here?
Just for a physical.
Okay. Can you tell me the month, day, and year?
September 26, 2015.
Okay. So Mr. Jones is alert and oriented. He's oriented to name, time, place, and situation. He's opening and closing his eyes spontaneously, and he has a good verbal response. So he has a Glasgow Coma scale of 15, which is the highest score possible. I'm going to begin the exam by looking at your skin, your hair, and your nails. I'm going to start with looking just at your face, and what I notice is you've got equal symmetry to your eyes, and your ears are equal bilaterally. Your nose is in the center of your face. I'm going to look at your hair. All right, your hair is clean, a little bit dry. There's no dandruff, no lesions, masses noted to the top of the head. Do you have any pain?
No, I don't.
I'm touching your head. Okay. Good. I'm going to peek at the skin on your back. All right. The skin appears to be warm, dry, and intact. Its color is equal bilaterally. I'm going to hold out your arms and look here. There's no varicose veins noted, no jaundice, no cyanosis, no pallor. I see you do have a few freckles on your back. Any history of skin cancer?
No.
No. Do you wear sunscreen when you're outside? Okay. Now look at the skin on your legs. Good. Again, equal color. Let's see. Do you have a problem? Any hair, skin, or nail problems that you've had in the
I have
past?
fungus on my big toes right now.
Okay. I see fungus bilaterally to the great toes. Okay. I'm going to inspect your fingernails if you'll hold your hands out for me. I'm going to check your capillary refill. Okay. And that's less than 2 seconds, which is normal, so that's great. The nail beds are smooth, good coloring. There's no clubbing, no spooning. Okay. I'm going to ask you to stand up now if you don't mind. All right, I'm going to take a look at your spine, checking for scoliosis, kyphosis, lordosis. Can you bend over and touch your toes? Good. The skin is midline, or the spine is midline. There's no curvature or deviation. All right, so no kyphosis, lordosis, or scoliosis appears to be present. All right. I'm going to check now. I'm going to start here. I'm going to feel for your temporal artery, your pulse there. Good, and I feel that bilaterally, strong, +2. And I'm going to listen with the bell of my stethoscope for any bruise present. And no bruise noted. I'm going to assess your jaw now, your temporomandibular joint. Upon inspection, there's no swelling. Can you open and close? The joint opens and closes smoothly. Is there any pain there?
No.
No? Good. All right, now I'm going to check for range of motion of your neck. All right. We're going to do flexion, extension. We're going to bend and then move it in a rotational pattern. So can you flex, touch your chin to your chest? Good. All right. Can you stand by reaching back? Good. Can you shake your head no? Great. And can you touch your ear to your shoulder? Good. Other side? Great job. Thank you. I'm going to check the elasticity of your skin now. And good. Your skin's elastic. It springs right back into place. There was no edema noted, no jaundice, no cyanosis. Okay, Mr. Jones, I'm going to test your thyroid now. I'm going to give you this sip of water. Go ahead and look at your trachea. Look at me straight ahead. Good. The trachea appears to be midline. All right. I'm going to test your thyroid. Go ahead and take a sip of water. Okay. I'm going to test your thyroid from the front. I'm going to use my right hand to push the thyroid. Go ahead and move your chin down just a little bit. Thanks. All right, go ahead and swallow for me. Okay. Go ahead and take a sip of water and swallow. Good. No enlargement of the thyroid's noted. I'm going to listen to the thyroid now with the bell of my stethoscope. Okay. Go ahead and swallow again.
Excuse me.
God bless you. Okay. No bruise or hurt. Alright. I'm going to assess your lymph nodes now. I'm going to start here with your pre-auricle. Any tenderness?
No.
And your post-auricle? Alright, good. Feeling the occipital? And now the retropharyngeal. Alright, moving on to the submandibular and the submental. Any tenderness noted?
No.
Alright, I'm going to do the superficial cervical chain. And then the the deep cervical chain. And lastly, the supraclavicular. Any tenderness noted?
No.
We're going to test your vision. We're standing 2 to 3 feet apart. We're going to start by checking peripheral vision. So go ahead and cover one eye. All right, and cover it loosely. Don't press down on it. Cover the same eye. And you tell me when you can see my fingers, okay?
Yes. Yes.
Okay, now cover your other eye.
Yes. Yes.
Okay. Good. You have normal peripheral vision. The next thing we're going to do is use the Snellen eye chart to determine your vision. If you'll stand back against the wall. Mr. Jones has contacts in today, so we're only going to test him with his contacts in, as he doesn't have any supplies to remove his contact lenses. So the Snellen eye chart is here. What we're going to do is we're going to cover one eye, then the other eye, and then we're going to have both eyes uncovered. So I want you to start at the top of the chart. Go ahead and cover one eye. Again, cover it loosely. Start at the top of the chart.
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, T, O, D, P, C, T, F, D, L, C, E, O.
Okay, Okay, so Mr. Jones, in your right eye, you appear to have 20/15 vision. Go ahead and cover your other eye. And again, let's start here and see if you can read this line.
PDC,
Okay?
LPED,
Uh-huh.
PECFD, EDF, CZP, FELO, FZD, DEF, POTEC. I can't read that.
All right, so 20/20 in the other eye, and then both eyes uncovered. Why don't we start here?
EDF, CZP,
Uh-huh.
FELO, PZD,
Uh-huh.
DEF, POTEC, LEFO, DPCT, FDPLTCEO. No, you can't read that.
All right, so when both eyes are uncovered, you appear to have 20/13 vision. The next thing we're going to do is I'm going to find my sheet. We're going to test for your near vision test card. What you want to do is hold this. You want to come stand here and have a seat. You want to hold this approximately 16 inches from your face and start at the beginning and see how far down you can read. Again, we'll do it with one eye covered and then the other eye covered, and then both uncovered.
ELZTCOFPD, DZECLFTOP.
Bless you.
Excuse me. That's the lowest line, the 24-inch line.
Okay. So here is the lowest you could read to. What about with your other eye? Oh, I'm sorry, you made it down that far?
Yes.
Okay, go ahead with your other eye.
I can read the I can read the FT.
Start at the top and read down.
EP, EOP, ZT, LCDF, TDPCF, ZOEL, DZEL, CFOTF, FEPCT, LOZD, PTL, FCZDEO, ELZTEO, FPD, and that's it.
Okay.
42 inches.
All right, to the 32-inch line, and then with both eyes uncovered.
EOPZTLCDF, TDPCFZOEL, DZELCFOTP, FEPCTLOZD, PTLFCZDEO, ELZTCOFPD, DZECLPTOF, and then LO, and then lost at the 20-inch line.
Okay, so the patient appears to have normal near vision, no presbyopia noted with his contacts in. Without your contacts, you've said that that's a different story, is that correct?
Yes,
Okay.
correct.
So you wear glasses for nearsightedness as well as farsightedness?
Yes, correct.
Okay, thank you. Okay, Mr. Dent, I'm going to continue by inspecting your eyes. If you'll look straight ahead at me. Good. Your eyes are green, beautiful green eyes. They're equal in size and shape. I'm going to palpate above. No tenderness noted, correct?
Correct.
All right, no masses felt. I'm noticing that the eyelashes curve outward, up towards the eyelid. There's no debris noted in the eyebrows or on the eyelashes. Go ahead and open for me. All right. Conjunctiva is pink. Bilaterally. Good. The sclera is white. No pressure lacrimal glands. No exudate noted. All right, then we are going to test your 6 cardinal fields. You're going to look directly at me. And move your eyes, follow my pen. All right, and your eyes are moving together. Good. With a split second of nystagmus noted, which is normal. Then I'm going to turn out the lights. I'm going to check your pupils. I'm going to shine the light on one eye. And the pupils are equal and reactive to light. I'm turning these lights on. The pupils are equal and reactive to light and accommodation. They're also round. Mr. Jones, I'm going to have you, now I'm going to check the corneal light reflex. I'm going to have you look directly at my pen light. I'm going to hold it 12 inches away. And I'm noting that the light is shining in the cornea on the same place, meaning you've got symmetrical placement. I'm going to look at your nose now. The nose appears a little midline. The septum is not deviated. I'm going to look up your nose. Good. Good. Nostrils appear to be the same size. I'm going to check for patency. If I can get you to hold your finger over the side of your nose and sniff. Good. Can you breathe freely out that nostril?
Yes.
Okay. And the other side? All right. Do you have any difference?
No.
No. Okay. Thank you. Now I'm going to look at your ears. Actually, I want you to close your eyes. I'm going to have you smell something and see if you can identify the smell. Go ahead and smell.
Alcohol.
Rubbing alcohol. Correct. Okay. All right, Mr. Jones, I'm going to take a look at your ears. Can wiggle them. I'm noticing that the helix, the antihelix, the tragus and the antitragus, and the lobule are all present. No debris or excessive amount of wax in the ear canal. Let me check your other ear as well. Same findings there. Do you have any problems with your hearing?
No.
Okay. Any dizziness?
No.
Okay. Okay, Mr. Jones, I'm going to inspect your mouth now. I'm noticing that your lips are pink and moist. Can you open your mouth for me? All right. Good. The buccal of the cheek is pink, wet, moist. All right. Looking at all your teeth appear to be present, and I don't see any fillings. Can you go ahead and stick your tongue out for me and say ah? Good. And I notice the uvula goes up when the patient says ah. The soft palate is present. Tonsils are present and free of any pus or lesions. Stick your tongue out. All right. Tongue is midline and tongue appears to be moist and wet. No mapping present. Okay. Mr. Jones, I'm going to teach you how to do a breast exam. Men as well as women can get breast cancer, and it's important for men to do a monthly exam as well. You're going to begin by placing your hands on your hips and looking in the mirror. You're going to look for any signs of discoloration, puckering, or dimpling. And then you're going to want to feel your breast. You can either go in a circular motion or in an up and down motion. Most men prefer the up and down, so you're going to just up and down, yep. And you're feeling for any tenderness, any masses, any changes noted. You also want to closely inspect your nipples to see if you have any discharge. And you want to do this, like I said, monthly, along with a testicular exam. Okay? Any questions there?
No.
No. All right, so can you show me how you would do it?
Look at the mirror.
Right.
And then
What are you looking for?
abnormalities.
Right. Being like any dimpling, any puckering, any masses if you notice one side's larger than the other.
Right, then I would use an up and down motion, and I would feel
Uh-huh. What are you feeling for?
masses,
Right.
anything that seems out of the ordinary.
Right.
And then then I would inspect the nipple,
Uh-huh.
and then I would be done.
Okay. You also want to lay down, put your hand above your head, and you want to feel under your arm. And here you're feeling again for any enlarged lymph nodes, any tenderness, so masses or tenderness.
Okay.
All right. And again, monthly.
Okay.
Okay, Mr. Jones, I'm going to now listen and look at your chest. I'm going to go ahead and take your robe down if that's okay. Is that all right?
Sure.
Okay. I'm going to slip out of this side. All right. The chest appears to be equal symmetrically. There's a regular rate and rhythm. The patient appears to be in no respiratory distress. I'm going to go ahead and listen to your lungs. Start with the front. Good deep breath. And out through your mouth. Regular rate and rhythm, no adventitious lung sounds noted. Go ahead and listen on your side. Deep breath. Again, in through your and again, I'm going to check the other side as well. Arm up. Sides are clear laterally. But I'll listen in the back. Go ahead, deep breath in through the mouth out. Rounded bounds are clear anterior, posterior, and laterally. No adventitious sounds heard. Okay, Mr. Jones, I'm going to now assess your carotid arteries and your pulses there, as well as your cardiovascular system, your heart and your pulses throughout your body. If you want to go ahead and lay down. Thanks. All right, I'm inspecting. I'm noticing bulges. Check for your carotid pulse. I'll only check one side at a time. And then with the bell of my stethoscope, I'm going to listen for any bruits. No bruits noted. Okay, I'm going to listen to your heart now. I'm going to start at the second intercostal space on the right side. Face right. And then I'm going to move over to the second intercostal space, face left. Down to Erb's point, which is the best place to hear the S2. Xiphoid. And then I'm going to go to the between the fourth and fifth intercostal space, mid-clavicular. To listen to the apex of the heart, which is also the best place to hear the mitral valve. Good. And I'm going to listen again with the bell of my stethoscope. All right, Mr. Jones, you have a regular rate and rhythm. I didn't hear any murmurs, gallops, or rubs. I'm going to check your pulses now. Start by feeling your radial. Good. I'm going to move up to your brachial. Good. This one, straight up. And we go to the popliteal. If you'll uncross your legs for me. Great. Our other side. And feel your dorsalis pedis. As well as your tibial. The pulses are all equal bilaterally. Strong rate and rhythm. Mr. Jones, I'm going to listen to your carotid artery again. I'm going to have you hold your breath while I'm listening. All right, breathe. Other side. Turn your head slightly. Back this way. Good. Also, there's no edema noted to either the upper or lower extremities. Okay, Mr. Jones, we're now going to test your cranial nerves. We tested cranial nerve 1, the olfactory nerve, when we had you smell the rubbing alcohol, which you were able to easily identify. We tested cranial nerve number 2, the optic nerve, when we did your near vision test. Cranial nerves 3, 4, and 5. The oculomotor, trochlear, and abducens were tested when we did the 6 cardinal fields of gaze. You did have a little bit of nystagmus when we did that, but that was just when your eyes were moving back rapidly from the lateral position, so that is considered normal. We are going to test cranial nerve 5. What I'm going to do is ask you to close your eyes. I'm going to put a piece of gauze to your face, and every time you feel that piece of gauze, I want you to say yes. Okay? You understand?
Yes.
All right.
Yes. 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 Yes.
So cranial nerve 5 appears to be intact. And that's the trigeminal nerve. Next, we are going to check cranial nerve 7, which is the facial nerve. I'm going to ask you to raise your eyebrows, puff out your cheeks. Good. Smile for me. Good. Can you frown? All right. Good. So cranial nerve 7 appears to be intact. Cranial nerves 9 and 10, the glossopharyngeal and vagus nerve. What I'm going to have you do is open your mouth, say on. I'm going to look at your uvula. Stick your tongue out. All right. The uvula remains midline and no deviation to either side. Then I'm going to ask you to swallow. Good. Swallow one more time. Okay. And you're able to do that. You're swallowing without difficulty, and the uvula did remain midline and didn't deviate. All right, we're going to test cranial nerve 11. Can you shrug both your shoulders? And then I'm going to ask you to shrug while I'm putting some pressure on you. Good. So cranial nerve 11 is intact. Lastly, we're going to check cranial nerve 12, the hypoglossal. I'm going to test the movement and the strength of your tongue. I'm going to ask you to stick out your tongue, move it to the left, move it to the right. Okay. Push your tongue against the inside of your cheek. Okay, and then on this side as well. Good. Cranial nerve 12 is without deficits or weakness noted. All right, Mr. Jones, I'm going to inspect your abdomen now. Do you mind if I raise your down? All right, good. All right, I'm going to go ahead and listen for bowel sounds. Bowel sounds are present in all 4 quadrants. And with my bell, I'm going to listen to your renal arteries. Your iliac. And your femoral. And your aorta. No breweries are noted. Okay, Mr. Jones, can I ask you to sit back up? Okay. Assess your musculoskeletal system now. Can you stand? All right, let me see you walk to the wall. Good. Heel to toe. Good. All right, can you stand with one foot? And then the other? All right. Gait and balance appear to be within normal limits. Can you tap one side toe and then the other? Good. With your fingers, can you go like this? Good. The patient appears to have coordination. Can you touch your finger to your nose repeatedly? Okay, can you close your eyes and do the same thing? Coordination is the same with your eyes open and closed. All right, the next thing, if you want to sit back down, the next thing we're going to do is go ahead and check your range of motion. We already checked your range of motion on your neck and your temporomandibular joint. We're going to check it now on your shoulders. Can you move your shoulders forward and backwards? And you can rotate them externally and internally. All right. With your elbows, your arm, are you able to bend, extend, supinate, and pronate? Good. All right. With your wrists, are you able to extend, hyperextend, and move side to side? All right. Your fingers, are you able to abduct and adduct? Good. Flex and extend. Hyperextend. Good. All right, and your hip, are you able to extend the legs straight and flex the knee to the chest? Abduct and adduct the leg and rotate your hip internally and externally. Are you able to flex and extend your knee? And with your feet, are you able to dorsiflex, plantar flex, invert and evert, adduct and abduct your feet?
What exactly do you mean?
Adduct, bring your feet in together.
Okay.
Abduct, bring them out. Good. Okay, Mr. Jones, can you hold my hand? I'm going to test your groom streak now. Can you grab my hand and squeeze? Good. Can you push against my hands? Good. All right. Your feet, can you wiggle your toes? Can you push against my hands? Good. And can you raise your feet up? Good. Okay, so Mr. Jones has active range of motion against resistance to all of his joints. Okay, Mr. Jones, next I'm going to test your deep tendon reflexes. If you'll skip back on the bed just a little bit. Let's start by testing your patellar reflexes. Good. And again. Good. So +2, both positive reflexes. Then I'm going to test your tricep reflex. So you're going to hold your arm in a 90-degree angle. Good. Good. On this side. Relax your arm. Good. Again, reflexes are positive to both sides. Plus, I'm going to test your brachial reflex. I'm going to tap my thumb with the phone. Good. And on this side. Good. So all your deep tendon reflexes were positive. All right, Mr. Jones, now we're going to test some more sensory items. I'm going to test for stereognosis. You put something in your hand and I want you to close your eyes. Hold it in your hand and tell me what you think it is.
A coin.
Good. Now I'm going to do the same thing in this hand. Open your eyes. And look at me. I'm going to put something in this hand and I want you to tell me what it is. Close your eyes. Can you tell me what it is?
Marble.
Yes. Good job. So, stereognosis is intact bilaterally. The next thing I'm going to test is for graphesthesia. I'm going to take your palm, you close your eyes, and I'm going to write a letter or number in your hand, and you let me know if you can tell what it is.
7.
Correct. All right, other palm. You want me to try again?
Yes, please.
Okay.
A.
Correct. All right, so your graphesthesia is intact bilaterally. And the last thing I'm going to test is discrimination between 2 points. I've got 2 small sharp objects. I'm going to start them far apart. When you feel them come to one place instead of 2 separate places, I want you to let me know, okay? You got it? Here we go.
2, 2, 2, 1.
Great. Let me try with the other hand as well.
2, 2, 2, 1.
Good. So discrimination is intact bilaterally. All right, Mr. Jones, the last thing I want you to do is stand back up. Sure, when we were walking earlier, I want to assess your walking one more time. Be sure you're walking heel to toe. That's perfect. If you want to go ahead and sit down, that's great. Thank you. I appreciate it. Well, that completes your physical assessment. You look like you're doing great and in great health. Do you have any questions or concerns for me?
Not at all.
Okay. Well, thank you so much, and the doctor will be in the room shortly.
Thank you.
Okay, in my assessment video yesterday, there were just a couple of things that I overlooked. I did want to mention that his gums were pink, wet, moist, healthy gums. Also, I want to show you accommodation. I want you to look at my finger. It's about 4 inches away. All right, now I want you to focus on the wall behind me. Focus on the wall behind me. And then back on my finger. All right. So his pupils are equal, round, and reactive to light, and also accommodation. They go from about 4 millimeters to 2 millimeters. And lastly, I wanted to do the whisper test to show you the vestibular cochlea, which is cranial nerve number 8. So I'm going to cover my mouth. I'm going to whisper to you. Oh, I'm sorry, you cover your ear. Cover your ear. I'm going to whisper to you, and you repeat what I said.
1, 2, 3.
Okay, and then I'm going to do the other side, so plug your other ear.
A, B, C.
Correct. And that concludes my video. Thank you.